welcome to another episode of Caring for You with me, Dr. Terence Drew. Today we're going to look at a neurological disease, a disease that I've seen much more frequently in the past number of months, and that disease is Parkinson's disease. What is Parkinson's disease? Parkinson's disease is a neurological disease which affects a certain part of the brain called the substantia nigra. And the manifestations mainly are shaking, stiffness, and slowness. We can remember a famous person who suffered from this disease was Muhammad Ali. What causes Parkinson's disease? Up to this day, we are not really sure. However, there are some suspected causes, such as head injury, certain types of toxins, possibly infections, vascular causes, such as some sort of poor circulation within the brain. Genetic can also be a possible cause. But whatever the cause is, this disease is a debilitating disease. So how is it diagnosed? It is fundamentally diagnosed by physical examination. There is no specific test that you can go to a lab for, or an X-ray for, or an MRI for, that will give you the diagnosis. The doctor does a physical exam, and based on that exam, he determines or she determines if you have Parkinson's disease. So once you are diagnosed, how do you treat Parkinson's disease? The treatment is still very frustrating. But what we do use here in St. Kitts in the Caribbean a lot, what we call medications that help the nervous system. One that we call L-Dopa or carbidopa. And we have it in combination, and we call it Cinemet. So this type of medication really helps to alleviate some of the symptoms of Parkinson's disease, even though it does not cure the disease. However, there are new approaches to treating Parkinson's disease, such as some brain stimulation. Others are now looking at whether you can treat it with stem cell, and that still is in the early stages of development. But there has to be a holistic approach where a person can engage in physical activity, occupational therapy. They might say a counselor, a psychologist, a neurologist, an internist, and their family physician. The family must also become involved with the treatment. For as the person loses some of their functions, it is important that the family understands that and can be a sense of support for the person who suffers from Parkinson's disease. I have seen patients as young as in their 20s all the way up to their 60s. And so I hope that this information will help you and your family to stay healthy. Thank you for joining me, Dr. Terence Drew, for another episode of Caring for You.